Hello, welcome to our YouTube channel. My name is Raiz and I'm the head of events for FizDoc for the year. The events team created this video with the fourth year students in mind, knowing that they're going to go into their elective towards the end of the year. Elective is the practical training and experience that a fourth year medical student undergoes at Wits University, usually towards the end of the year, in any clinical rotation and in any hospital of their choice. We know that the process can be quite stressful in choosing your elective, where you're going to do it. So what we did was we put up an Instagram poll to which current fourth year students could submit questions, request advice from current fifth year students who have just completed their elective. We hope that this initiative is helpful to all the fourth year students busy with their elective application processes, and we hope that you enjoy the video.
My name is Caitlin Slaughter. I am currently a fifth year medical student at Wits University, and I'm currently placed at Charlotte for a surgery rotation.
My name is Marcel Blacknote. I'm a fifth year medical student here at Wits. I'm currently in my internal medicine rotation, second week in at Helen Joseph Hospital.
Hi, I'm Denise. I'm a Chem 3 student. I'm currently rotating through internal med at Charlotte Macquarie Johannesburg Academic Hospital.
My name is Kimberly January. I'm a fifth year medical student and I'm currently doing internal medicine at Helen Joseph Hospital.
So I chose to do my electives in KZN, and the two hospitals that I chose were King Edward Hospital and Inkosi Albert Lutuli Central Hospital. And at King Edward Hospital, I chose to do obstetrics and gynecology, and at the other hospital, I did trauma ICU.
I did my elective at St. George's University Hospital, which is in London, the United Kingdom, specifically Tooting, so South London. And I did all 4 weeks there in the Department of Rheumatology.
I split up my 4-week elective into 2 stints of 2 weeks. First 2 weeks I did in the internal medicine department at Moore Park Hospital. And the following 2 weeks I did it in research at Barra.
So I did 2 weeks of emergency medicine and 2 weeks of neonatology, both at Sinja.
Obviously, KZN is outside of the Wits circuit, so both hospitals I had to apply independently. And the process is that you contact the doctor, so you find a doctor that's working at the hospital you'd like to go to, and you send them an email requesting if you can do your electives there, and then they will say yes or no, and then from there you need to email the UKZN elective office. So basically they will guide you through the process. You need all your vaccinations up to date. If you're a Wits student, you would have had your MMR vaccination done, as well as your hepatitis vaccinations done. So those are all in order. You need to submit proof of that. And then there's an application form you'll fill out, and will just basically entail where you go to university, what year you're in, which hospital you'd like to apply to, and in which department, and then they will accept you from there.
So I always knew I wanted to do it in rheumatology because I've always had an interest for lungs. I just searched NHS hospitals, London, rheumatologists, and I just kind of whatever results came up, I scanned through some of the rheumatologists. So then I came to 2 rheumatologists at St. George's University Hospital, which is where I ended up doing my elective. And I did reach out to both of them. The one came back to me and quite quickly, and she ended up being my supervisor. So that was Professor Lady Sofat. So the important thing about doing an elective overseas is that there are some medical, legal, or ethical issues with doing it overseas, in the sense of in South Africa, if you do it at a Wits hospital, you're more likely to be able to be very much more hands-on with practical work and suturing and those kind of things. But when it's overseas, it becomes a bit more complicated because they might not be as familiar with your curriculum. It's difficult to talk because every country, specialty, department, or hospital is going to have a separate application process and procedures. So that's why I went the observership route. And that was organized with the hospital itself directly and its HR department. I just got in contact with the person at that hospital's department, got through the different documentation, so just had to fill out a short application form, send in my CV, get a police clearance certificate from SAPS, which took quite a while, and then just also my visa once I got my visa approved, and organized that. And it was quite other, in that sense, quite a smooth sailing application process. It's more the other things that go with organizing an international elective, like a visa, flight accommodation if relevant, that you have to sort out, which is quite admin. So this was just my experience.
I think it definitely can be a little tedious, depending on the doctors or the specialty or the area you want to go into. You may have to do some running after the doctors in order to get a response, to get them to allow you to come. So I think the best thing to do is to try and start the process early, especially if you want to go somewhere that's not easily accessible, such as outside of Johannesburg.
Since I was in the Wits circuit, it was pretty simple. We got a document and there were a whole bunch of like specialties, and then it had the contact details. So I just emailed the people that I wanted to go to.
So Hospital 1 was King Edward Hospital, and I was there for obstetrics and gynecology. So it was quite different to what I'm used to. First of all, it was my first time rotating through obstetrics and gynecology, so I found it a bit challenging with the expectations that maybe they thought I had a lot more knowledge than what I actually had, given that the students at UKZN start their clinical years at third year level, whereas we only started fifth year level. So I found that quite challenging, that I had to integrate into a team of students that were already in sixth year. So that was quite an interesting dynamic, but I learned quite a lot from them. And in terms of the routine, I'd have to get there every day at 7 a.m. My day would end at about 5 p.m. It would consist of a ward round, any ward work. I'd attach myself to an intern, so we'd do the ward work needed, and then if there was theatre booked for that day, any surgeries, then I would attend those. Yeah, and my supervisors my supervisor at one day, it was Dr. Green Thompson, Professor Green Thompson, and he is the head of the Department for Obstetrics and Gynecology. So often I would be attached to a registrar, so one of his registrars, and then I'd follow them around for the day. Because when you contact these heads of department, they're often quite busy, so they usually give you to the team, and that's how you navigate and find your space.
So rheumatology as a specialty, it's not too intense like surgery, so there weren't anything like calls or insane hours. So for me, my average day was from 9 a.m. until 3 p.m. or 4 p.m. So on my first day when I met with my supervisor, we met up and we kind of discussed some of the things that I would like to get involved in. From there we created a roster. So generally speaking, every morning on each day there was a different specialist clinic. So one day there would be an axial spondyloarthritis clinic, another day there would be an osteoarthritis clinic, or one day there was a lupus clinic, and another was an osteoporosis clinic. And I'd also see other diseases and other cases on those clinics as well. And that allowed me to get quite a wide range of exposure. Then do ultrasounds on the joints, some bone density scans. So I got quite a variety of exposure. Also went up to the ward sometimes and sat in on grand rounds and those kind of things, or even the biologic clinics. So essentially quite a wide range of exposure on each day. The consultants were always very nice in the clinics. They were always very open to involving me, having me ask questions between patients, or even during the consultations, asking me questions, and testing my theory. Oftentimes I didn't know, they'd ask me very complicated questions. The supervisor, Prof. Sofat, her interest is osteoarthritis, so I sat in a lot of her clinics, and we had really lengthy discussions, and we often had discussions about how things differed between South Africa and the UK, and that really helped me kind of, based on what I'd seen, discuss some of the differences. And we developed a really, really good relationship. We got very close by the end of my elective, and we're actually still in contact, and we've even been in touch about doing some research projects and collaborations between the UK and South Africa.
I think it's important to choose areas that you're interested in, because often, depending on where you go, at least in my experience, I did find structure wasn't always the highest on the agenda. I think where I went, I more or less in the first 2 weeks at Mopop just kind of shadowed and followed the doctor around. There was no set structure or set things that I was seeing. I was kind of just seeing whatever was happening on the day. But I really did enjoy my time there. I saw some very cool things related to internal med, and I really enjoyed forming relationships with the doctors, which I think is gonna always hold us in good stead going forward.
In terms of my overall experience, I did enjoy being more active and like part of the hospital environment, For emergency med, there were quite a few of us, so we were split into two groups, like one that came in the morning, one that came in the afternoon, and then we did that for 1 week, and then the next week we swapped. And so the second week I came in the afternoon and I had the morning off. And then we also had the opportunity to experience being on call, which was from, I think it was 7 p.m. to 7 a.m. And then for neonatology, I was just there during the day. For emergency med, there wasn't really a routine. Like in the morning or in the afternoon, whenever you come in, there was a ward round. So you just go for the ward round, which is pretty quick. And then the rest of the time, you kind of just like find something to do, which can be a bit challenging because it was kind of quiet. And then for neonatology, the daily routine was like rounding with a reg in the morning, and then like later in the day, I would generally help the interns with ward work. And then challenges, I think in both of them, like I'm quite introverted, so the challenge was like putting myself out there, because when you're in like the hospital space, like everyone's busy with their own work and no one's gonna like call you and be like, oh, come do this, you can do this. So you kind of just have to find things to do for yourself, and you have to like approach people and ask like, how can I help out? It is a bit intimidating because like everyone is there for work and like they have a purpose. And as a student, you kind of don't know like what you're allowed to do, what you're not allowed to do. And so that was a bit challenging, but it's also exciting, like being exposed to everything.
Okay, so for a significant skill that I learned that changed probably my perspective on medicine, just excited me, was definitely getting to observe a tracheotomy. So that was amazing. Also the insertion of an ICD drain. So that's an intercostal drain. So it was very, very interesting. The doctor also let me remove it and also suture after, which was quite an experience. I don't think I'll even have that in my next 2 years at Wits. So that was really amazing. And that was at Inkosi Albert Witwatersrand Central Hospital. Another experience, I got to scrub in theatre, so I got to assist on a burns patient. I did my first skin graft. I learned how to mesh skin and all these other cool skills, which was amazing. So yeah, it was an incredible experience.
I found the hospital cultures largely to be similar. I think in our South African setting, we have so many people in need of healthcare and limited healthcare resources, and I think whether this was at Moorpark or Barra, I definitely saw this being the case. Every doctor and nurse, every physio, every hospital manager, everyone involved is incredibly busy, working incredibly hard. And I think the hospital culture seemed to be similar to me, one of fast pace and hard work.
So I think the most challenging was like coming to terms with the fact that death is a reality in this like field. Like, you have it in the back of your mind, obviously, like death is part of life, but like actually like seeing it is quite, it's quite different. And like even if someone doesn't die, like there was a time in neonatology when a baby needed to be resuscitated. Like that was like the scariest moment of my whole elective experience. Like I was so terrified, but at least the baby survived. So most rewarding, I think, also in neonatology, like I went to clinic on one of the days, and that's where like the babies who were like born prematurely, like they get followed up, obviously. And so it was so rewarding to see how like they've gone from like incubators with like all these tubes in them, not growing well, and now they're like functioning, reaching their developmental milestones. Like it was precious.
I had one interaction that I think definitely stood out for me. This was at Moorpark in the internal med department, and there was just a patient, and the interaction was with me by extension, but largely it was with the doctor I was following. And the interaction was just one of immense gratitude and immense happiness at the outcomes that were achieved in his case. And I think it was just a very rewarding interaction to remember just how important the work one does can be, you know, both on a population level and, you know, to each individual.
I think napping is important. I'm not gonna lie, I love my sleep. So like if I was in the morning session when I got home, take a nap. If I was in the afternoon session, like sleep in, because sleep is important, especially this year when you don't really have that luxury. And then I think also like talking to people. So with emergency med, there were a whole lot of students. So like we'd always like debrief after, and that really helped, especially like, you know, when patients die, it's emergency med, that happens quite often. So like just being able to talk about it, and like they validate, even the doctors sometimes spoke with us and like debriefed, and it like validates your feelings, like I'm not crazy for being like so emotional that the patient is dead now, you know. And then with neonatology, like I was alone, but like during my lunch breaks or like in the morning, I'd meet up with some of my friends, and like they'd listen to like my stories, and I could like de-stress, and then I'd also hear their stories, and so like it helped. And it also, like when you hear other people's stories, it also puts things in perspective.
Where I saw just how difficult it is for even one advancement to be made, because there's so many barriers. There's funding, there's barriers related to ensuring safety, and I think I just gained an appreciation for just how difficult scientific advancements in medicine can be, because I think despite the fact that we are so in dire need of constant advancement, we have so many pathologies raging through our country, but I definitely saw both how difficult it can be, but also just how amazing going through that difficulty and arduous nature of research can be. So for example, I saw through certain clinical trials new vaccines and treatments that may be coming about, and they affect us in our lifetime, which I think is quite amazing.
Honestly, it depends on the skills you want to practice. Like if you want to practice taking blood, putting up drips, inserting catheters, then like emergency med or trauma. Also, I learned that like those are two different things. And then if you want to practice like examination techniques, then like if you want to do CVS, then go to cardiology. Like one of my friends did cardio, and like she learned a lot about like auscultation and like listening. So yeah, it honestly depends on what skills you want to be practicing.
I definitely think benefits, would obviously be the kind of cliche things. I think you would broaden your horizons both generally in life and in medicine. I do think there's a whole world out there in both aspects to see. I think there's a lot of value in if you are able to go out of Johannesburg or go out of the country. There's a lot of value in seeing what the world has to offer, both medically and otherwise. I do think one could grow immensely in that way. But I do think there are obviously certain disadvantages. It can be very difficult to source a doctor with which you can do your elective outside of Johannesburg. It can be very difficult, especially internationally. I know a lot of people that did go had to really put in a lot of admin throughout the year to ensure that it happens. And obviously it would be quite expensive. But I do think there are certain opportunities one should look into. There are certain scholarships and opportunities where your travel may be paid for. One should look into those. I can't remember off the top of my head the names, but I know a friend of mine did do that. So I'd say the benefits are immense, but there are the cost and the admin may be difficult. But if you are able to go, I would encourage you. I do think we spend a lot of time in South African medicine, so I don't see any drawback from seeing something different. And you could always split the elective. You could always do 2 weeks in Joburg and 2 weeks in other province, or 2 weeks in Joburg, or 2 weeks overseas. So yeah, I definitely would say if you are able to consider it, I do think it would be of value.
Be prepared to approach people. Like you're not going to be approached and told what to do, or given a patient and be like, okay, do this and this and this. Like you have to go out and find things to do yourselves. So I wish I'd like mentally prepared for that.
Take the pathologies you're learning, ecology, the micro, etc. and kind of just package it or format it in your own head and in your own notes in such a way that it would be directly related to patient care.
Even if you're scared, like do it scared, do whatever, and really try to do as much as you can, because yeah, you're still learning and it's a great way to like cement things in your head.
Make of your elective what you want to and what you can make of it. I mean, this is a 4-week opportunity to go into something that intrigues you. It doesn't have to be the speciality or the field with the most hands-on experience necessarily, or one that you feel like is going to expose you to skills that you're going to see in 5th and 6th year, because at the end of the day, we're all going to get that exposure in 5th and 6th year. So if you want to go for that, absolutely, but it's really the opportunity for you to choose a field that interests you, that you might not get a lot of exposure to in medical school at the undergraduate level, something that you want to get experience with, something that you think you'll enjoy, that you'll learn a lot from. You know, it's built into the academic calendar, so really make use of those 4 weeks.
Try to spend as much time as possible, like knowing your theory and your clinical skills, because there's not much time in 5th year to perfect that.
Just enjoy it, have fun.
Do as much as you can, but don't do too much. Enjoy your holiday while you can.
And just have fun. I think 4th year is the last year, I'm going to sound terrible, but 4th year is the last year to have a lot of fun. When you come to 5th year, there's now calls and the expectation is extreme, where you feel like you just left out in the desert to your own devices, where now you're used to leaving the hospital at 12 o'clock in the afternoon and going every 2 weeks, and now you're leaving at 10 o'clock in the night, 1 o'clock in the morning for your calls. So master the things you can in 4th year so that the incline to 5th year is not as steep.
Thank you so much for watching this YouTube video. We hope that it was insightful and that it offers a bit more of a personal narration of the elective experience, hearing it coming from medical students at Wits themselves. To all the 4th year medical students at Wits currently busy with your elective application processes, I wish you all the best, and I sincerely hope that you guys enjoy your elective at the end of the year. Please support the society by giving this video a thumbs up and subscribing to the Physician Society YouTube channel to keep up to date with all the initiatives, workshops and events that we host at Wits. Thank you so much for watching.